the idea of MAT first came up here, my immediate reaction was to say, no way, not a chance, not here. But I think that when I was able to get honest with myself, the question came up that if we're calling ourselves an individualized treatment program, then isn't it irresponsible for us to say we're an individualized treatment program, but only within the framework of what we've always done before, or only within the framework of what we believe according to our personal experience. So if somebody is interested in taking Suboxone, just like if somebody is interested in taking opiates, it's not difficult for them to get it. And these medications are not intended to be prescribed as a standalone treatment. So if we know that people are having access to this medication and they're having access to it without an effective treatment program, don't we then have a responsibility to offer this medication with an effective treatment program so that it can be used as it's designed, which is with a therapist, with a treatment program, with group dynamics, with addressing underlying issues and trauma. This is the way it's intended to work.
My name is Dr. Daud. I'm an addiction psychiatrist and I'm the medical director of Transformations Drug and Alcohol Treatment Center. The reason traditionally why people were not able to continue treatment, or they end up leaving treatment earlier, they're not able to engage in treatment, is because they have a significant amount of cravings, or they have withdrawal symptoms, post-acute withdrawal symptoms, even after a complete detox, where they're not able to fully give their entire concentration and their entire self to the treatment. The idea of Suboxone is helping to reduce that overall dependence of opioids, to reduce the cravings and the withdrawal symptoms to a degree where they can actually engage in treatment. The treatment is the most important part of this. The Suboxone is simply something that helps an individual really engage in that treatment.
So there are people that are unwilling to even go to treatment if they have to go from what they're doing to nothing. PAWS, which are post-acute withdrawal symptoms, can take from 6 months to a year to go away. It's pretty clear to most clinicians that addiction is not just about a physical addiction to a substance. If people never get the opportunity to speak to a therapist to look at some of those underlying issues, nothing's going to change. They're going to continue to use. And if for some portion of the population, beginning to deal with those issues comes with having something that allows them to have a little bit less discomfort as they begin to look at those things, and that gets them to where they need to be, then it seems like we're doing a disservice by not offering that.
The goal in the end is always going to be abstinence, even from the Suboxone. So a realistic goal with the prescriber and with the therapist needs to be achieved when the patient is ready to start coming off of the medication. Then that medication will be slowly reduced over time until discontinuation.
We've always had a transitional based model, meaning we go from very high structure, very high supervision, and very high level of care to a medium structure, medium supervision, to lower structure. What we tell people is that if they go straight from being in like the bubble of treatment and having all of these services and all of this support to nothing, that's going to set them up for a relapse. And I think this is the same idea. This is not to say that everybody who comes here should be on this medication, just like everybody who comes here shouldn't be on an antipsychotic medication or a mood stabilizer. And I think it makes sense for us to provide this as one potential option for people who would be supported by it. Just like everybody I know in recovery and even who works in this field, I've lost a lot of friends and a lot of clients, almost all of them opiate addicts. It's very clear that there's a section of the population, that there's a significant number of people who aren't responding to treatment without the support of medication. The stigma about utilizing certain types of medications in the recovery community and even in the country is definitely still there. And I think that the thing that is going to change that is if reputable, effective, honest programs do this the right way. Being one of those resources that utilizes these medications effectively could change a lot. It could change a lot with individual lives, and it could change a lot with the culture surrounding addiction and recovery.
Audio Jungle.